the whole of the month is Sepsis Month, but on the 13th, there's going to be people on social media sharing lots of things. So I thought I'd give you guys some extra information ahead of a few days ahead of that. So I'm going to start with a one question quiz that I tried this out on Graham, and he was quite surprised by the answer. In the UK, how many people do you think are killed by sepsis? Is it 1 a day, 1 an hour, or 5 per hour? And this is killed by it, not that. So there'll be a lot more people that are affected by it, but this is just literally just the worst possible, the deaths. What does anyone think?
No idea.
1 an hour.
I think 1 an hour, possibly more than that.
It's 5 per hour.
Yeah, I thought it might be the most. Yeah.
So yeah, that's about every 12 minutes.
Ooh.
And for every person that sadly dies of it, there's like another 4 people who are affected, and the like the consequences can be really quite severe in some cases. So it's still like there's been a huge push to recognise it, and there's been loads of progress made on training doctors and recognising it earlier. There's lots of new sort of clinical algorithms for picking it up quicker that are quite often built into the computer systems even, so it flags it up for you, which is fantastic, but it's still happening. So
well, what is it actually? Can you give us some idea what it is?
Yes, that was the next. Yeah, so it's something that the human body does. It's the immune system. It overreacts to an infection so severely that without treatment it is life-threatening. So it could include things like shock, different organs could fail, and it can be fatal if not treated in time. It can happen to anybody, but it's particularly common small babies, people who are older than 75 years, or people with something wrong with their immune system. So it's not so much about the infection that you have, it's the body's reaction to it. So there's loads of different infections, and pretty common stuff that wouldn't normally worry you that much. I mean, obviously pneumonia, you would worry about that, but you wouldn't expect something like a urinary tract infection, or maybe sort of if you've got a cut or something and it's gotten quite inflamed, or sort of appendicitis, you wouldn't necessarily expect the body to suddenly massively overreact in this way. So pretty much any kind of infection can set this weird chain reaction off, and it's just very unpredictable is the problem, and a lot of the symptoms kind of overlap with the thing that's caused it. So somebody with COVID-19, you could expect them to be quite ill with it. So noticing when that tips over and sepsis has happened, it can be quite tricky. So the cat's pulling the curtains down.
It was interrupting quickly. It was on telly last night.
Oh, was it? What?
Cause of Death. If anyone watches the Cause of Death series, one of the people they found, the coroner was investigating, the cause of death was dodgy coronary artery, but sepsis caused by his ulcerated legs, which he didn't bother having treated because the toxicity of the sepsis gave him the impression, oh, it's not that bad, I don't need to do anything. So the actual infection created a situation where he didn't see the need to go and get help. Yeah,
I think unfortunately that is something that's quite common, and I'll get onto that a bit later. Yeah, infections can really mess with your judgment, unfortunately. So lots of different things can cause it. Like usually it's bacterial, like about 94% of cases are bacterial. But there is a chunk of them. About 1 in 20 sepsis cases is fungal. So it's not Aspergillus or the sort of Scedosporium or any of those molds. It's Candida yeast, because it's something that lives on the human body just naturally. It's just part of your little ecosystem, and it can get into the blood in different ways I'll cover in a second. So that's very, very difficult, because on top of having to identify the sepsis, you then have to very, very, very urgently work out that it's not bacterial and it needs to be an antifungal instead. So the treatment's different, and the blood tests for detecting it, it's different tests. So that is really it's not an easy one to diagnose. Very, very, very rarely, like almost hardly ever, if somebody has the invasive aspergillosis in their lungs, like if somebody's already very, very unwell, probably in intensive care, and then they get an invasive aspergillosis, very, very rarely that can trigger sepsis, but it doesn't, it wouldn't happen from chronic aspergillosis.
It would if you got a bleed and the bleed got infected.
Yes, that would, yeah, that would be more like, yeah, that, well, yeah. So yeah. If it turned into invasive and started doing more of it.
I got pumped with full of antibiotics in hospital.
Yeah.
Almost continuously for 10 days because I've got an open wound in the lungs.
Yeah. Yeah, so the body was thinking it was invasive.
Yeah, well, the body was thinking,
oh, it doesn't know what's going on.
You got something wrong with you.
Yeah.
So there was a risk.
Yeah.
There was an enhanced risk of infection.
Yeah.
So the consultant did everything he could to stop it happening.
Yeah. And it's difficult because the more different antibiotics and antifungals and things you give somebody, you're layering up all the side effects and interactions as well. It is there's so much discussion goes on behind the scenes of when do we give the different things, in what order do we try them. There's a huge amount of work going on that, and it is hard. Yeah. And very occasionally a virus can cause it. I think apart from it, that would normally be COVID, sometimes can, or sort of viral meningitis can occasionally trigger it, but it's not usually a viral thing, because that's sort of a different part of the immune system. So the important thing, what can I do? Because it's one of those things where it's worth looking out for and knowing how to recognize it. But if you worried about things like this, you'd just be worrying all day, every day. You'd never be able to calm down. So the main thing for most people is just knowing symptoms and knowing which symptoms mean call an ambulance now, and which ones mean don't wait till the morning. So there's a couple of really good guides to this. There's one on the NHS website under nhs.uk/conditions/sepsis. That's got a really good guide. And the UK Sepsis Trust, which I've just put a couple of little screen grabs on the right, they also have a list of things. So things that would make an illness cross the line into, no, this needs looked at, this is urgent now, would be something like, so if you haven't gone for a wee all day, that's a very, very classic sign of sepsis, because it's sort of to do, it does very strange things, like your blood pressure drops and how you manage fluids goes very, very strange, sort of a shock response. So that's really one to look out for. If your skin looks kind of like mottled or just a bit of a funny, just not the right colour like it normally does, that's also an emergency. And if you get confused, like quite a lot of infections do cause like we were saying, causes confusion, and that means this is urgent. At the very least, call 111, call a relative, but it's important not, so like people that live alone especially, if somebody has these symptoms and they go to bed and think, oh, I'll see how I am in the morning, these symptoms you don't go to sleep on, because you might not wake up, and it might be something quite preventable, unfortunately. So actually 2 years ago, my granny spent Christmas Day and Boxing Day on the ward because she had an infection, and she'd noticed that she was really thirsty and a bit confused, but she didn't really tell us, and then because she didn't want to make a fuss, and then it deteriorated. So it's things like that, don't ignore them, is the main thing. There's slight similar-ish symptoms in children. They can also like have a fit or like convulsions. I think that sort of with the fevers, babies are more susceptible to that. And just sort of being very, very sleepy. And obviously, if anyone has a rash that doesn't disappear when you press on it, that could be sepsis, it could be meningitis. So that's always one to just go straight to hospital for. So yeah, at the very least, 111. But these are the severe symptoms. And there's some people that you need to be extra cautious with. So anyone, so like I said before, people who are older adults, like especially over 75, and when people start getting more health problems, where they're having treatments for, that can sort of layer up risk factors. So anything that's immunosuppressant, so transplant drugs, oral steroids, chemotherapy, and some monoclonal antibodies. I don't have a list of which ones specifically, but if you know that your immune system is being affected by treatments, then you need to be a bit more suspicious of this. If somebody's already having quite frequent infections of any kind and then having courses of antibiotics for them as well, those are both risk factors. And if you've got sort of any broken skin, so yeah, like Mick was saying, wounds, or if you've had recent surgery or medical devices, like different IV lines or anything at home, if you're having these symptoms and maybe that broken skin looks red and angry, that's a clear sign that it needs looked at urgently. So if you go into hospital, there was a big campaign, I think about 18 months ago, the Could This Be Sepsis campaign, and it was just encouraging patients and their relatives, if they've got concerns about this kind of thing, to just straight out ask the doctor or the nurse, could this be sepsis? Because I think people used to feel a bit more shy, like not wanting to sort of question or tell the doctor how to do this job. But if you ask, could this be sepsis? If they don't think it is, they'll just tell you no because of X, Y, and Z. They shouldn't be offended. It's not rude in the slightest, so feel free to do that. And also, if you or one of your loved ones does go through this, it's rough. It is really, it can really take it out of you. And sometimes it takes people months to really recover, not just physically and not just because it's really upsetting sort of emotionally, but also cognitively, like memory and concentration and brain fog and just sort of being able to do anything. It can take people longer than you would think to really get back to normal. And just take care of them, help them take it steady, and just be a bit patient.